Good morning. Your Excellency, Mr. Jabali, Prime Minister of Tunisia, my brother, Donald, Dr. Kabaruka, President of the African Development Bank, and of course, Mr. Moderator, Minister of Finance from Tanzania. Excellencies, I see many Ministers of Health and Finance in the audience. Thank you for joining us. And I see many friends, ladies and gentlemen. My brother promised to be short, and I promised to be long. And that's how we play this duet. He is talking about health, and I'm talking about finance. We want to show you, as an example, we must understand the contribution and the importance and the impact of the other sector, and how we can reinforce each other. Let me first and foremost thank the government of Tunisia for being such a gracious host in hosting this extremely important meeting at an opportune time, actually an urgent time. I thank Africa's Ministers of Health and Finance for starting a very important dialogue. This is great, this is good, and I want to thank you. You did this dialogue before the conference. We need this kind of new thinking and this kind of new approach. Africa is making progress, sometimes stunning progress, but ways need to be found to accelerate this progress in all countries, not just in a few countries. You have decided, ladies and gentlemen, to focus on improving efficiencies, reducing waste, and using existing resources in more transparent and accountable manners. You want to improve coordination between countries and their development partners and among the various sectors of the government. As I said, this is an opportune time, an urgent time for doing so. In April 2001, the landmark Abuja commitment called on African nations to allocate at least 15% of their domestic budgets to health. More than a decade now, we are in 2012. Only 6 of these 53 African Union member states have done so. Even more disturbing is the fact that 11 African countries are investing a mere $5 or less per person per year in health. And this is far below the amount of money needed to care for the most basic health needs. This level of spending leaves the health system impoverished and does nothing to tackle the crippling shortage of healthcare workers that affect Africa most acutely. It perpetuates some problems with deep roots that impede economic progress, put a brake on development, and keep poor people and poor nations trapped in poverty. The decade since the Abuja commitment has been a very eventful one. Our interconnected world was beset by one global crisis after another. The consequences were highly contagious and profoundly unfair, adversely affecting countries that had nothing to do with the causes of these crises. The consequences linger on. The world economy is still suffering from the shock of the 2008 financial crisis. We see no end in sight. Money is tight and spending is careful and cautious. Everyone wants value for money. Donald, I want to thank you, your team, working with partners of the HHA in organizing this extremely important meeting to talk about value for money. Donors demand it because they are under intense domestic pressure from the public and from the parliamentarians to show that taxpayers' money invested in health development is bringing results, good results. When belts keep getting tighter at home and domestic health budgets are being cut, it becomes much harder for them to justify spending to improve health abroad. Not all of the news is bad, actually, ladies and gentlemen, not by any means. When the financial crisis hit in 2008, African economies suffered the least than those in most other parts of the world, and economic growth remains strong, as you have alluded to, Donald. The banks tell us that the African continent is now on a path to sustainable growth and poverty reduction. More and more African countries are being ranked as middle-income countries. Policymakers increasingly recognize that improved health is a prerequisite for sustainable development. They recognize that the health sector, when properly managed, is an important source of economic growth and employment. What we must all face now is stagnation, probably even a decline in external funds made available for health development. This makes commitment of domestic funds for health and their wise use all the more important. And I'm making a strong appeal to the ministers of finance from developing countries, middle-income countries in Africa, that you need to support your ministers of health. I'm biased, you can say that. What else can I do? I'm a health person, right? If I don't do that, I would be failing my ministers of health. But there is good economic case, and this is a good business case. And that is what this conference is all about. How can ministers of health work in tandem with ministers of finance, speed up the progress towards better health in Africa in ways that anticipate a stagnation or even a decline in external financial support? The money is simply not there anymore. In other words, how can smart planning, smart policy choices, would a frank dialogue like this one help African governments do more for health with resources that already exist? How can your joint effort to identify and reduce inefficiency and waste, to improve accountability as well as health outcomes, and ensure good value for money? I know DFID is always giving us this value for money call, and I see Simon is here representing DFID. Simon, you need to do better to support us, okay? While health planning and policy choices are the responsibility of health ministers, finance ministers will need to do more to raise domestic resources for health. You can do it. You can afford that. As set out in your documentation, a review of 22 low-income countries in this continent show that, collectively, these countries could raise more than $1.4 billion by doing one thing: increase tobacco tax by 50%. That doesn't cost you a dime. All you need to do is to get the parliamentarians to support you, get the right legislation in place, hammer the tobacco industry, for good reasons too. They give you a lot of diseases called heart disease, cancers, and others. And that's why there's good reason to raise tobacco tax. I'm very passionate every time I talk about tobacco control. I hope you would excuse me. Ladies and gentlemen, as I said, this conference has been exceptionally important and well prepared, and your work is supported by excellent background papers, discussions about practical problems, constraints within individual countries, and the brainstorming meetings of ministers of health and finance to jointly analyze some deep-seated, long-standing problems. What pleases us the most is that you have been very frank and fair in your dialogue, attributing some of the blame for low budgets and slow progress to both sides. Ministers of finance continue to see health as an unproductive sector. They see it as a black hole, a drain on resources instead of a gain in economic productivity and well-being. It's true. Ill health is a drain on resources, on household resources as well as on public funds. But good health is an economic asset for sustainable development. For those of you who have attended the Rio +20 meeting, again and again you hear this message coming out very clearly. Good health is a precondition for sustainable development. As you have noted, health planning and budgeting have not always been based on evidence and conditioned by an analysis of country-specific constraints to service delivery. nor do they always comply with requirements for budget preparation and execution as set out by ministers of finance. So I would urge the ministers of health to take heed of the conditions that your ministers of health need to meet in order to help you. If the two sides are not working to support each other, health will not get the money, and finance ministers, you will not get the productivity gain in GDP. I was taught by the ministers of finance in Ghana, by investing in health, the country has made tremendous progress in GDP. And that's important for ministers of finance. So I think, both health and finance ministers can work together to reinforce each other's. But what is important for ministers of health to document success or otherwise is you need good information, health information system. If I tell you 86 countries in WHO do not have good vital registration, how are you going to count births and deaths? How are you going to report progress on immunization? How are you going to tell how many women die from giving birth? And if you don't have good and reliable cause of death, you don't even know what your population are dying from. Is it heart disease? Is it cancer? Or it is communicable diseases? So without a robust health information system, you cannot track progress over time and cannot answer the question whether you are getting value for money. And most devastating is you cannot be held accountable by your voters. The Arab Spring, Donald, as you have put it, and Tunisia is a wonderful example to show how the voices of the voters, the voices of the people, can get their voices heard. Inequity, inequality, poor access to health will trap people in poverty. WHO statistics have shown that more than 100 million people per year are pushed into poverty because of ill health. When you have no job, no health, no money, this is not a stable situation, and people can topple governments, as we have seen it in several countries in this part of the world. Now, let me once again appreciate the excellent collaboration of the Harmonization for Health in Africa initiative, and I need to thank all the partners here. Otherwise, I would be failing my duty. And the important partners in this HHA include, of course, the African Development Bank, the World Bank, UNICEF, UNAIDS, UNFPA, USAID, JICA. You mean you don't like JICA? JICA is a good partner. The Global Fund, UN Women, NORAD, and WHO. The Harmonization for Health in Africa initiative works regionally. And this is, reinforced at that global level by the International Health Partnership Plus, which was actually initiated by DFID when I was Director General in my first term, working with my sister, Joy Pumafi. At that time, she was working in the World Bank as Vice President. Joy, you recall that, didn't you? We were pushing the man and to get this done. And I want to thank all of you for continuing this movement. I have a lot of hope and optimism on what the HHA can do for Africa, for all the countries in the African Union. And of course, moving forward, if we talk about equity, universal access, we need to talk about health financing, proper health financing to provide social protection for people, especially women and children. And there is another important initiative which I must mention, which is called Providing for Health Initiative. And here again, a group of countries like Australia, France, Germany, Switzerland, UK, and US, and the Rockefeller Foundation are staunch supporters in working countries to share best practices and see how you can provide universal access to your people. Let me finish on 2 points. Rwanda is an amazing country. one of those countries who have allocated more than 15% of its total budget to health and is making excellent progress in universal health coverage. In another continent, Mexico, I was just in Mexico, celebrating the great achievement of the country. More than 95% of the people are covered. And the Sakura Popular, initiated by you, Julio, in the audience when you were Minister of Health in the country, is making excellent progress. These are just two examples from two continents. But of course, there are many more. Brazil, you mentioned it. China is moving forward. And I'm extremely pleased to hear Prime Minister Singh of India committing universal health access to their people. Indonesia is doing that. More than 50 countries, after we launched the World Health Report 2010 on health financing, more than 50 countries from middle income and LDC countries is requesting technical support from WHO and the World Bank. But now we would extend this partnership working with the African Development Bank to support countries to move towards universal health coverage. That is important if we believe in the right to health. That is important if we believe in equity. And that is important if we believe in social justice. On that, let me once again thank all of you for joining this meeting, but most important of all, the HHA partners for organizing this, and last but not the least, Mr. Prime Minister, your great country for being, hosting this extremely important meeting. Thank you.